We are, we are. Um, Thank you all for joining us these last few episodes. I think Tiffany and I are, I wasn't hitting a stride, but it's been really cool to share some of these things. And I know last episode recording, I was pretty wiped out at the end. It just has been kind of heavy, but also invigorating in a way to talk through some of the issues that we see, and experience. And so we're going to continue that today from more of a personal self lens of like what we've experienced personally in our own care, but also professionally, like serving other patients and clients. And so um, we're really excited to kind of continue that discussion on like trauma informed care and medical trauma and healthcare trauma and all those things and like how they're interconnected a bit. I feel like all my social work friends would be really proud of me because I'm like just connecting one thing to the next thing to the next thing and not saying it's one big thing. But Tiffany, I feel like you deserve to get the chance to start us off on where we
What?
go with this today. I feel like I'm always steering us and then you
Uh,
have to respond. Do you want to start or do you want me to? It's all good.
so we are going to talk about what is the best way to frame this? The trauma, financial trauma, and mixed in with medical trauma surrounding like just the medical field of our profession and like trying to find an actual like good therapist.
Yeah. So finding a therapist is super personal. So at the very least, it's like someone you feel like can help you with the issue you're dealing with. So there's a lot of, I don't want to say hot takes or controversies, but I would say within like the clinical therapy community, there's a lot of different views on what this should look like. So I am going to acknowledge what is maybe more my view of this, and then also just for the sake of our listeners, Tiffany getting to be able to be like, okay, well, this is what I'm looking for, or this is a different opinion. Because obviously it's a podcast, so Tiffany and I have our opinions, but also there are other opinions and other uh, options. So with that being said, I think what we're looking for when we're looking for a therapist is someone we can trust, someone that is we can depend on, and someone that is able to help with what we're looking to be helped with. So, yes, people can get a marriage and family therapist license, a social work license, a counseling license, but that may not mean that they know what is going on or what is maybe related to a topic. So a good example I have is that I did an addictions internship in my master's program. I'd never taken an addictions class.
Can I pause? Can we also acknowledge the people that and this is probably throwing a lot of shade. Can we also acknowledge the people that are sliding into our field under the coaching label?
Oh, that feels like a whole nother episode, doesn't it?
I just want to put that out there though, that there are people that are when you're looking for a therapist, it comes up as a coaching. Um, and that kind of complicates the process.
Yeah, and I will say, I'll touch this lightly because I think there's a lot of, so I think coaching has been how some people have tried to get around licensing in different states. And you can get licensed in different states. It's complicated, it's expensive. So there's
It's
things like
very
PSYPACs
expensive.
or the counseling compacts. I think in Ohio, it's Arizona and Minnesota that you can get licensed in if you have that license. But it is a little complicated really quickly, really, really quickly.
Yeah.
But coaches, yes, there are some who are licensed, there are some who are not. My biggest gripe with coaches is the ones that aren't trained to do anything at all, being business coaches or being life coaches or spirit. Like it's just, so I know that they're coming up with training programs and some are doing training so they can be helpful, like financial coaching. But yeah, it's not great. It's not great. There's really no set body to license, and there are for counseling. So for example, Tiffany and I cannot come on and say, as a counselor, this like there are certain things we can and can't do when we are using our license. Like we have rules
No.
about how we even can advertise.
Yeah, I was gonna say I don't even know if we can like advertise ourselves. Someone else has to advertise us for us because isn't that considered us soliciting?
Yeah, so we can't ask our clients to give us reviews. We can't give them an incentive. We can't respond to reviews because it's a HIPAA file. We have to be there's a lot of things that must be protected and for obviously very good reason. Um, so, yeah, I think coaches are different. So, coaches are unlicensed folks typically. Some are trained, some are not. But even just to be clear, like there are certain things that we as counselors have to do for billing, like accessible services, treatment coordination. So, if someone loses insurance, I'm not able to just say, well, good luck to you. Like, I am obligated to try to make sure that they're getting connected or at the very least letting them know a way to go. And that, I mean, coaches may be doing that, but they may not also. So, yeah, one is regulated and licensed, one is not. But yeah, there's just a lot of different things within therapy that one could be like eating disorders. Like I'm not an eating disorder therapist. I'm not a specialist working with young kids for therapy. So there are just lots of different things. So on the one hand, you can have a license and yes, it says you can do therapy. And the other thing is scope of practice and competency. And when I was talking earlier about hot takes or controversy in the therapy, like this is where I would say not there's disagreements within even modalities people are trained in, or how they're using it, or when to. So I don't want to I don't want anyone listening to be like, oh, I shouldn't go to therapy because there's issues. It's just we have been in this transition of becoming a health being in the healthcare field, being science and data driven. And some therapists rock with that, love it. And, all therapists are using evidence based practices because that's what we have to do. But there are some who are more interested in what they're interested in and have seen people have success with different things. But I really feel like the need is to use hard science and data that are peer reviewed, double blind study. That is what we're supposed to be doing. And so when we're looking at what are the best, when I say best, I mean with the most data and the most representation of what has been shown to be effective in therapy. CBT continues to be the gold standard, regardless of how any of my therapist or counselor friends feel about this. It is the gold standard. It has the most data, the
Yeah.
most
Who knew changing
results.
thought patterns could be so effective?
Right. But I think our field is just one that we're very insular, and so I think sometimes we don't move very quickly, and I have this sense that not everyone stays connected or works as a part of the therapy community, so then it's like what your lens is or portion or island is. If you're in private practice, you're not maybe connect to everything. If you're in a community mental health system, maybe you're not able to do long-term therapy. So I think there's this need for different systems are better for different things. So, I've talked about gambling disorder treatment. Like there are centers who have whole gatherings of treatment and can really offer things. Same for eating disorders. But if you went to just a general private practice place, they probably aren't going to have all of that.
Mhm.
I have
Yeah.
ADHD. Not everyone has lived experience. Some people want that lived experience or different identities, and that's okay.
Yeah.
So there's just like a million things. So I think, Tiffany and I were talking a little bit before we started recording this because I was like, honestly, this can go 7 million different directions. And so I think, that's where trying to give a realistic thing of what is going on, what is helpful, what is not. But Tiffany, what would you throw out for now?
Uh, I don't know. I think I just adding to what you were saying that like it's rough out there, and there are a lot of people who um present themselves in ways that is just shady, and confuses the public and gives the public like a bad overall image or understanding of what our profession really is.
When you say, what do you think is the biggest misunderstanding?
Um, Like that like we are like what you see on like social media, like that, like you show up, we shake our head and say, yeah, uh-huh, how does that make you feel? Kind of vibe. Um, Granted, in some transparency, Eric, you probably have more social media knowledge on like what it says about what therapy is supposed to look like or does look like, since I am removed more so from the social media realm.
Yeah, I will just say that TikTok is like hot garbage. Um, I
Dumpster
think we
fire.
I think we've shifted. It was great. I think social media is great, like in its intention of connecting people, and it's great that there are some people doing really ethical influencing, where it's accurate information, portrayal of pregnancy, postpartum, or depression or anxiety. But there is so much garbage about, like, if we just stick with ADHD, I mean, the New York Times came out, and I think they had like actual counselors and researchers like evaluate these ADHD videos, and they're like over half of them are incorrect, over half of them do not have um, accurate information. So at that point, like it's just like a coin flip of what's real, what's not. And I think we have to be careful, where are we consuming the information? So like
That's
this,
crazy.
oh, have you ever, not wanted to go to work on a Friday? I'm making up one just right now.
All
And
the
it's like, oh,
time.
and it's like, oh, have you ever felt burnout at work? That's a sign that you have autism or ADHD. It's like, I mean, that's how broad some of these videos are.
Ooh,
Like,
I'm
it's really
sorry.
honestly
Triggered.
how,
I'm triggered.
no, it's okay.
Um, and it's that, and it's something totally like we would have to discuss on another session. The the popular thing that I've been encountering is like we're all neurodivergent, and I'm like, ooh boy, does that rub the wrong way? Does it feel invalidating for people who legit have the struggle and have to like, have accommodations to actually help them function, and to say that, oh, we're all neurodivergent. I don't know about you, but that one gives me the ugh.
It's really dishonoring. I mean, it's almost like everyone's saying they have trauma or PTSD. It's like, it's really invalidating as someone who works with many people who are living and dealing with
Mhm.
PTSD. There's this fundamental misunderstanding that like there is a impact that is a deficiency or disruption in your day-to-day life. So if you have PTSD, it's not everything is roses and perfect. There's something that is impacting your life. That's how the
Mhm.
symptoms are showing up, or anxiety or depression, or pick which disorder we're discussing. And so it really does piss me off when people are just sitting there like, oh yeah, I have this or that. Like, I almost feel like a year ago it was like very in vogue to have a mental health, which is on the one hand great that stigma's changed so much, where it's like, yeah, we're going to honor this, and I love that for people. And on the other hand, not everyone has depression and anxiety and PTSD or ADHD or autism. And it's gotten to like the flip side, where I have some colleagues who do assessments for ADHD and autism, and it's like everyone's coming in expecting to get that diagnosis. And when they don't, sometimes it's like a whole crisis for them, because it's like, oh my God, like, what does that mean?
Mhm.
And I think some of this may be with us, Tiffany, as counselors, we maybe throw those words around maybe too casually sometimes. And so it's
This is true.
allowed people
Yeah.
to,
Mhm. And I think too, something that like a missing part of the puzzle piece that often I see, um sometimes like not even like thought about, is the fact of like how integrated things like TikTok have been for younger generations, and like that fear of being boredom, or like not knowing how to deal with boredom, or like your brain being trained from a very young age to enjoy like small dopamine hits. So your brain is like, well, it's normal for me to like shift gears really quickly because that's what was normalized for me. That's what I'm used to, which can mimic neurodivergent traits. But I just, not to get us too far off track, but that one just really irks me. And one of the, like, it's just so invalidating. And on some level, like, I understand where people are coming from, where I'm like, yeah, everyone's brain technically on some level functions differently. Otherwise, we would all be exactly the same. Like biologically, no two people are alike. Can't acknowledge that. But like to say like we're all neurodivergent and like invalidate people's experience with their brains to function so differently that society actually punishes them for it, both covertly and overtly, is very dismissive.
Have you ever had a client had that experience?
With like the
Being dismissed after they've tried to maybe go forward or get more information?
dismissed in that like, oh, you don't have it, or oh that like you
Like
do.
they've been told they have it, they've gotten that validation somewhere, and then they go somewhere else, and it's like, no, you don't.
Yeah, I have. I have had numerous people come in and they're like, so I went here and they say that I don't have it, or um I've had individuals that come in, they're like, I've been tested before years ago. It was just like this 1 hour like question survey. So I guess I just don't have it. And I'm like, a 1 hour, one meeting question survey, like that does not feel efficient to say that you know how someone's brain works. They are intensive assessments for a reason to really help us understand and like view when neurodivergence is prominent to a level that meets a clinical standard that then puts someone's brain in a on the spectrum level of like it probably would be helpful to have some extra supports in your life so that your brain doesn't feel like it's functioning at a deficit or you're like functioning like 20 feet behind everyone else.
Wow. So Tiffany, what do you look for in a counselor? What do you tell maybe clients or friends to look for in a counselor if they're trying to find someone?
I always tell people like shop around. Um, totally fine to shop around. I personally look for someone who has lived experience, and that they give the best friend vibe, but they're not your best friend. Like there's very clear boundaries of like, oh, they're down to earth, they're grounded. It's that comfortable space that you can talk in, but they're also very clearly like, hey, like what the fuck are you doing? Kind of thing. That's what I look for. I'm not a big fan of the people who are like highly reflective and they're like, oh, like I hear that makes you feel frustrated, which I know can be helpful for some people. But as a neurodivergent person myself, I'm like, I don't care that that makes me angry. Well, like I care that it makes me angry, but like I need you to help me to figure out why it's making me angry. I'm more interested in the why versus like sitting in the feeling and like wallowing in it. Um, which I know everyone is different, and some people might be like, "Oh my gosh," but that's just personally how my brain works and my preference for like my own growth journey.
Wow. What are the biggest red flags, the icks, when you hear about someone that's maybe worked with someone else before, and then you're hearing about it when you're working with them about past therapists?
My biggest icks, I've heard that someone's therapist would let them watch YouTube videos all session. That was an interesting one. I've heard that therapists will make judgmental comments. Um, I've heard time and time again of like, it's really annoying when my therapist just asks me how my day was going and just talks about how my day's been. Um, it's really annoying when my therapist isn't showing up and actually like challenging me to do work. Um, and that being said, too, keeping in mind that a lot of the population that I work with, probably as a reflection of my own neurodivergence, are neurodivergent and they're not looking for um, just kind of like sitting in the experience. They're looking for more of like the why. So keeping in mind that some people might actually be like, "Well, I want someone who's just gonna ask me how I'm doing." Like, that might feel super supportive for someone else, and that's okay.
Yeah. I've had some people not be challenged at all. I've also had some clients who've never been affirmed at all, and I think you really need both, and it's a mix of both for knowing when, and, like, sometimes you have to recalibrate, like, what you're gonna talk about or not talk about, or how you're gonna talk about something, or even how you're gonna work on something. Um, like, I've heard, like, maybe clinical issues, like, I remember I've had a client who was discussing that they smoked cannabis, like, maybe every couple days, and then that was not what was bringing them to therapy, and then the counselor said, "You need to go to residential treatment as an adult with no other issues," and so,
Wait a minute. Can we pause for a second? Like, is this before or after, like, this shit became
um, it was a few years ago, so I think it may have been before it was legal, but
Okay.
sincerely, like, be very rare that someone needs residential treatment only because of,
Smoking.
cannabis. I
Yeah.
mean, there'd have to be some other things.
That feels I don't know about you, but that feels like a competency cop out.
Yeah, no, it was. I mean, it was. I mean, that's and what Tiffany's referring to in that, for those who may not know, is that sometimes there's another reason someone doesn't want to work with someone, and so they'll look for something else to hang on to for the why of why they're not able to work with them. I think I've shared this story. I actually don't remember their name, so I couldn't tell you the name if I wanted, but when I was looking for a counselor, I was looking for, like, a trauma counselor, just someone to support me. We were having this consult. I thought they had, like, some cool trainings that, like, I didn't know about, and I thought I was like, "Okay, this is someone that's done it. I can respect them, and I'm looking for someone I can click with," the stuff we're all talking about here. And, we were talking, it's going great. We had a consult, we're on a video, like, and then it goes into scheduling. And then I was like, "Oh, I really appreciate, what you're doing, as a fellow counselor. Like, I appreciate it, I'm excited." And, like, the whole demeanor of this person changed. They were like, "Oh, I'm so sorry. I'm gonna have to talk to, like, my supervisor, because I'm not sure. I'll have to get back with you." And I promised you it was that swift of, like, we were having a good thing talking about scheduling, and then that happened, and then I think, like, 4 or 5 days later, they emailed me as expected. Like, I was like, "They're not gonna go." And they said, "I've talked with my supervisor at this time. I'm not gonna be able to take you on as a client." Uh, some some bullshit, honestly. It was real fluffed. Like, they probably had it was just, like, the most stale thing. And you know,
That's hard.
I did call them out, and I said, I think you need to explore in your own supervision and maybe therapy of what shifted for you when you heard that I was a counselor and why everything was going well, and we were talking about scheduling, to then, "Oh, I need to consult with a supervisor and not." Like, that's really jarring. But to be fair, if that's how they were and then we were at, they weren't the right fit for me.
Mhm.
So on the one
But
hand, they're
there's
not wrong. On the other hand, that was a really shitty way they handled that.
Yeah, but there's a lot. I don't know in your journey if you experienced it as much as I did, but there's a lot of people, the moment you mention you're a therapist, you kind of get like that, oh, okay. And I'm like, what is so what is so scary about working with like someone in your own profession?
And I think people just don't wanna risk, like, being caught. I don't know. It sketches me out. The whole thing really sketches me out, and I think that's where our field can kinda suck sometimes, is it's, like, very disjointed.
Mhm.
Not that
But I
hospitals are, like, the answer, or big systems have it
Mhm.
all figured out, but it's so choppy. Like, you have to, "Do you take my insurance?" "Well, no, I take Anthem Medicaid, but I don't take Anthem." "Oh, okay. I take Marketplace, I don't do that." Like, it's just there's so much crap that I think we get the worst of all of the healthcare stuff because it's insurance, it's access, it's specialists, it's presentation, identification. I mean, it's just all these things kind of tied up in one fell swoop.
Yeah. Well, also too, like what you said about like I think people are afraid to get caught. Like, I think that's very accurate, but also I can imagine for people listening to that, like, very scary of like, "Oh my gosh," like, there's the sense that therapists aren't getting therapy for themselves to like manage because therapy's fucking weighs on you. Um, that we're all sitting like some of a large majority are sitting out here afraid to get caught. Like that, then that presents the image of like, what are you guys doing that's you're worried that you're getting caught doing? Like, why aren't you just like ethically being good at your profession? Well, I don't know good,
I
but ethically
I
following.
I think it's just like, I don't know, maybe it's like we think we're gonna be our own worst patients, but it's weird. But I think in general, most people will need therapy at some point for some kind of situation. Some people won't come at all, and that's okay. Like, I mean, it's kind of like, I mean, if you had back pain, not everyone's going to go to a chiropractor or physical therapy. I mean, there are options for some things. I mean, I think I would say a lot of times people wait till it's maybe too, I should too intense, where like it's more escalated and intense. And so like, and as a couples therapist, that's what a lot of the discussion is. Like a lot of people wait for things to be pretty intense before they're willing to come in. And so that makes the work much harder. Kind of like if I had an issue with my neck like a year ago or so, and I like just wasn't going in. I was like, "Oh, I'll fix it. I'll fix it." And no, I really had messed it up to the point where like I really did need to go and like talk to some, like not talk to someone, like get it sorted out. And then it felt so much better. I felt like immediate relief. Um, so I think it's like knowing when to go. I don't see when not to go, but also, it's like I think in a great consult, you're saying this is what I'm looking for. What would be your plan? How would you approach this? What's your typical caseload? Who's your typical client? Most counselors, we should be able to say that. Like at this point in my life, I'm not seeing everyone. I'm not seeing every type of issue. Every once in a while, there's something that's a little different. I mean, all therapists will work with some version of anxiety and depression and some version of life transitions. That is what therapy, I think, really excels in. And then you get into some of the niches of like, okay, well, what about teenagers or adolescents or family therapy or trauma therapy or college students? Or, I know some counselors who have a niche working with people who are dealing with cancer. That's a beautiful, hard, very hard job that they're doing, but a much needed service they offer. So I think it's just different things. So could you find someone that's not a specialist in maternal mental health and still have a good therapy experience? Sure. But if that's what you're wanting to focus on, I think it's absolutely fair that you're trying to find that. I also think that a lot of the times there's a lot of factors. Like I think it's scheduling. Like when is someone able to see you? How often are they able to see you? Like if you're wanting to meet weekly, are they able to do that? Is it like, hey, I'll see you in 3 months? Like that sucks if you're trying to make progress. It takes 4 to 6 sessions in therapy to make progress. That'll suck if you really can't meet more than once a month. I also think maybe we as people need to be realistic. You go to the dentist during the week. I'm not aware of many dentists or anything that's really open on the weekends, so you take time off. But therapy, I get, is a little different. It's more of a consistent thing. It's not a one-off doctor appointment, so it's hard to go every week. But there's scheduling, there's insurance, there's fit, there's all types of things that I think line up with things. And also, I don't know if everybody understands that the calendar gets busy. We are healthcare. So at the end of the year, when people have met their insurance deductibles, yeah, like same thing. It's like, well, let me go get therapy. Like, I want to do therapy. Well, I've met my deductibles. Let me come in. And then like the beginning of the year, it's very open. So some clients, honestly, like if you were looking to get, it was like probably the beginning of the year is a great time to look for therapy, honestly, because a lot of people have these extra openings if they're taking insurance because people are like, oh, my deductibles reset. End of the
Hmm.
year, kind of harder. Most people are off. But I just think there's like all these little factors and things, and it's okay. Like every counselor will have people who say, "Hey, it's not the right fit." That happens all the time. That's why we do consults. We don't want to waste your time. Usually, after a consult, I'll know if it's a good fit or not, and we'll move forward. Um, but the other thing is sometimes things change. And I want to make sure I set a standard for this. If you message your counselor and say, "Hey, it was great working with you," or "Hey, I found someone else a better fit for me, wish you well," the only response to that is, "Thank you for letting me know. Great. I wish you well with your therapy. Good luck
Yeah,
to you."
that is
That's the only
yeah,
appropriate response.
yeah. I have That has been my response majority of the time, even when it's been like, "Well, you didn't provide me with what I needed." And I'm like, "I'm really sorry that, I wasn't didn't give you the experience you needed, and I wish you the best in your journey, and I'm happy to offer you some referrals to colleagues or something closer to what you're looking for." Um, I think too, mentioning that, some people give me weird side eye for saying this, but like we're products. Our service is a consumable product, and there are some times when people try it and they're like, "Yeah, I don't like this product." It's no different than if you try like a new flavor of like soft drink or something, and you're like, "Yeah, this is gross." Like you're allowed to like not purchase more or not engage more with that.
Yeah. I Therapists are people like all of us, and so I just wanna say that because I've heard some really interesting things. Now, sometimes, like, I've asked to wrap up something, like, if I've worked in someone for a long time, I was like, "Hey, are we still able just to close out some things?" Because like, there is closure that sometimes is needed depending on the work, but if they say no, it's all good. It's like, "Okay, if you're good, it's not about me. My closure is not what you need, so like my closure isn't my client's responsibility. That's my own stuff. So I just think that's fair. But also, you learn a lot of like how long did it take you to like hear back from that person when you reached out? What are you looking for? Um, but there's just different systems. So if you're looking to work with a specific person and specific interests, like it may be a different setup. If it's their practice, they do everything versus it's a group practice or it's a community organization or whatever, it's an online thing, there's
Mhm.
so many different things that I think will just be different for everyone. So I think just kind of knowing, okay, like what the situation is and what's going on with it, I think that will be helpful for a lot of people just to kind of have an awareness of
Mhm.
what works and what doesn't.
Yeah, and I think too, being able just to remind people that like you're allowed to advocate for yourself, you're allowed to search around and like explore what you need. Like there's nothing wrong with like just taking some time to look for what is right for you.
Yeah, and sometimes it's like people don't know, and so there may be a, hey, I'm not sure how I'm going to work on my gambling challenge, or I'm not sure how I'm going to heal my trauma, or so it's okay to be like, I'm not sure, but I think knowing what you want out of therapy and making sure that person can provide it to you. Like I'm a male therapist, obviously, but I've had clients who are like, I've never worked with a male therapist before. I don't know how I feel about that. And like my only response to that is like, thank you for letting me know. If that's something you're open to exploring, I'm happy to explore that with you. And also, it's absolutely okay. I know plenty of female therapists. So it's just this whole kind of, it's like, we gotta be really making sure we're taking care of the patient and the
Mhm.
person and the client, not just ourselves. And so that's where I think sometimes we lose some things. And so, I've had, but this is why I think I'm on my soapbox a little bit today. Is like I have family friends, and they're dealing with like, we'll just say some really significant mental health stuff, or friends or family, and they'll ask me, hey, can you help us, because they're having such a shit time finding someone or connecting or knowing how to navigate the system to get. And I understand, because like if my family member or my daughter needed something, I'm gonna go into everything and make sure I'm doing my very best and like I'm getting them the best thing I can possibly get for them. And I think most parents and family members, they're gonna do the same thing.
Mhm.
So I just think we need a better system. This is I get the system that's currently there is not easy to navigate. Like legitimately, Tiffany and I usually start off our calls before we start recording, checking in about the issues we're dealing with insurance, or you know, healthcare, EHR, or whatever. It's like it's so difficult, and we work at it. So that it's like we're
Yeah.
dealing with the same issues when we're trying to help someone we know. Now, I guess if we know a lot of people locally, so we could, like, they're our
Mhm.
friends, so it's a little easier to call someone or be like, "Hey, could you help with this?"
Yeah.
Um,
Well, and too, like thinking, like piggybacking off of that, like we do have some insight, so we kind of know like who we would want to refer to, who we would feel safe like sending our family members to. And not everyone like outside of our field has that luxury. And it, that can compound in itself medical trauma of like people having to do that journey on their own and, sometimes settling for, something that might not be the best for them or the best fit or what they're exactly looking for because like maybe that's the only therapist that has openings. Maybe that's the only therapist that accepts their insurance. Maybe that's the only place that like they could find.
Yeah. I mean, also, not every therapy, sorry to say this, not every therapy thing, like my clients, it's funny. I can tell I'm doing better explaining this to all my clients because they'll say it back to me. I'm like, yeah, not everyone needs therapy for forever, like lifelong permanent therapy. Some do, but most do not. Like I would say 95% to 98% of people, they're not going to need permanent ongoing therapy. That's not
Yeah.
really how it's designed or a
Yeah.
thing.
There are
Um,
some outliers though, and like I want to keep in mind too, like permanent therapy can be like once a month, once every 2 months. It doesn't have to be like every single week.
correct. So I think there's some people they know, hey, this is for my balance or wellness. But also, if you're self-paying, you don't have to do the medical necessity, and we could go into all this stuff. So,
Mhm.
like, but our obviously, right? Our ethics, and you're like, hey, like, empower people, not fostering independence, not dependence. And so we're trying to grow. But yeah, I know there are folks like they do better having that accountability, that check-in. And so I definitely understand. Um, what you're saying. And it's just interesting though, because I think it's like, yeah, we need to demystify the therapy process. And I think it just doesn't unless you've gone through it maybe a few times or had someone close to you go through it, it sounds like I just don't think everyone understands it. Like I think I understand, okay, I chip a tooth, I go to the dentist, they fill my tooth. I go in and they fill it. I break my arm, I go, they put my arm in a cast. Like I don't know if everybody understands my anxiety is so flared up. I have like, what do I do to
Mhm.
heal that, fix that. I think there's like this. So I love all the shows that are showing therapy, and I love the discussions. I love how we've really challenged a lot of the stigma around it. I also think, though, it's not a linear process, and I think it's still hard for people to maybe fully understand sometimes. And I think that's where we have a lot of room to grow in explaining what we're doing.
Yeah. And I think too, as you were saying that, like I wish like we could sit down and maybe we figure this out, share a screen and just go through like all of the different platforms that pop up and what it would look like to look for a therapist just to like give people an understanding of how overwhelming it can be and how that just googling their like anxiety therapy, how much of a like initial crazy hump that is to get over. And then when you reach out to, let's say, 2 to 3 therapists and you don't hear from them or like they just you just never hear from them and it's like, oh my gosh, like this is frustrating and invalidating that I'm like attempting to get help and like these helpers just aren't acknowledging me. Whether that's by purpose, by like thing going to a spam folder, um, you know, can be really harmful.
Yeah. So I think maybe healthcare trauma we're talking about maybe like counselor search process trauma and some of the issues that maybe is more today than anything else. But I appreciate getting the chance to have maybe a more thorough discussion, and we're excited to kind of continue to bring more and more of this to the forefront. But I mean, Tiffany, anything else for you that you'd like to maybe discuss or bring up today?
No, I think that kind of wraps up our main focus of just like how traumatic and stressful it can be, and even financially traumatic and stressful to find healthcare that like matches you. Kind of, the reason people give up. Yeah. But that being said, I appreciate you guys being here and us getting spicy. And we will talk to everyone next time.
Bye, guys.